Good afternoon, everyone. My name is Ryan Semp, Government and External Affairs Manager here at the Dubuque Area Chamber of Commerce. On behalf of myself, our CEO, Molly Grover, our board chair, Darren Harmon, and the entire chamber team, thank you so much for joining us today for today's webinar on vaccine distribution in Phase 1 and Phase 1B. Before we begin, I want to thank our ultimate presenting sponsors for today's event, Medical Associates Clinic and Health Plans, Midwest One Bank, Q Casino, and TH Media. A warm round of applause for them from wherever you are back at home. Today's webinar, we'll be covering a lot of information, but our hope is that what you'll get out of this is where we are in the vaccine distribution process, what we can expect as we move through Phase 1 into Phase 2, and even further beyond that, and how the business community can be a part of that process. We encourage you all to use the chat feature and enter any questions that you have. Questions will be answered at the end of the webinar, and we'll have a robust Q&A time here at the end for everyone. Today's webinar will begin with a presentation from the incident management team, the Dubuque County Incident Management Team, presented by Mary Rose Corrigan, City of Dubuque Public Health Specialist. Along with Mary Rose today, the incident management team is comprised of Tom Berger, Dubuque County Emergency Management Director, Patrice Lambert, Dubuque County Health Department Executive Director, and Stacy Killian, Dubuque Visiting Nurse Association Director. In addition, we also have Cheryl Syke from Medical Associates Clinic and Health Plans, who is their Chief HR Officer to help answer questions from an HR employer perspective. So with all of that laid out here, I'm gonna get things rolling and hand it right off to Mary Rose. So with that, Mary Rose.
Okay, great. Thank you, and thank you for the chamber for bringing this group together. I think it's an excellent way for us to get out vaccine information, and I know you will all be good communicators to your coworkers and friends and family about where we're at with vaccines. Here we all are. This is the incident management team, and we've been working closely together for about a year now, and multiple times a day. Anyway, I want to give just an overview of where we are in terms of the pandemic, and this is what we call the epi curve, or the epidemiological curve, of all the cases that have occurred in Dubuque County, and this is through February 19th. So the one thing you can notice is that we've had a few peaks and valleys. So it started out, you know, mid-May, around the 15th, we kind of had our first peak, and things kind of died down a little bit around Memorial Day. Then the first part of July and mid-July, we had another pretty significant peak, which really affected a lot of our young adults. Then as school started, and before school started, things kind of simmered down a little bit. And then starting in September and really all the way through November, we had our biggest peak of all. And since that time, the numbers have gradually fallen. And this is kind of true around the country. The peaks and valleys may not have occurred at these exact same times in various communities and states and countries for that matter, but we're seeing this kind of pattern of peaks and valleys. And you know, what it's attributed to, I think the verdict's still out, and further research as time goes on will inform us. It could be, you know, people started new or more mitigation strategies. You know, we added a lot of testing in early July that pointed out those cases. So this is just where we are today and where we've been. And this is a breakdown of the age groups that have had the cases. And you can see that the younger adult group of 19 to 24 has really had the most cases, but it's virtually affected every age group. And this pattern has kind of held steady since this summer. But there's really two important things I want you to remember from today. And that is the things that we really have to focus on when vaccines are in short supply, as they are now. We look at the number of people that are hospitalized, which means they're having severe disease. And we look at the ages of those. And by far, the people who are hospitalized due to COVID are over 60 years old. Although, you know, the 19 to 24-year-olds and the ages around those have had the most cases, they make up a very small proportion of the hospitalizations. Likewise, you know, the worst outcome of COVID-19 is death, and it is a lagging indicator, means it can show up weeks to months after initial infection. But by far, the greatest amount of people that have died from COVID-19 are 65 and older. And we haven't had a death in anyone below 41, age 41, and there have been very few below age 50. So this signifies the people that are most at risk of severe outcomes from COVID. And this is just the trend line of how deaths have lined up. They follow those peaks I pointed out to you earlier. So let's talk about vaccine. We can't assume that everybody wants this vaccine, and we're going to be doing a lot of education as we get into more broad priority groups and we get more vaccine. But just to reemphasize the benefits, you know, the vaccine will keep you from getting COVID-19. It is a safer way to help build up protection and immunity. And by safer, I mean it's safer than having the disease, because we don't know how the disease will affect each individual. So you don't want to use that as a way to create immunity if you can help it. It's a tool for stopping the pandemic, and it will prevent serious illness from COVID-19. Now, we know that the vaccine is not 100% effective. I mean, the studies of the two vaccines we have now show it's very highly effective, 94 and 95%, probably higher than any other vaccine we have. However, it's an individual thing how your vaccine reacts to, how your body reacts to vaccine. So even if you get the vaccine and if you're unfortunate that you still get COVID illness, you will not become as sick, and we will prevent those hospitalizations and death. And then finally, the really important thing is that COVID-19 cannot make you sick with COVID-19. It's not a live virus, it's a messenger RNA methodology that's been developed over the past 10 years, which is for any vaccination. They've been working on this messenger RNA method. And so that's part of the reason they were able to get this out in a shorter amount of time. So one thing I want to add just about this is you will probably have a few minor side effects from the vaccine, such as a sore arm, and you may get some fever and chills for a day, body aches, those kinds of things. But those will go away quickly and will resolve. And it actually shows that your immune system is working by making a response. So one thing we've done to address our 65 and older population is we've created a sleeves up, which is our Dubuque County vaccination symbol, logo, phone line for people, primarily residents 65 and older without a primary health care provider, to call. So if someone age 65 and older does not have a doctor, they can call this number and leave their name and contact information. And then as we receive vaccine that various providers can give out, those people will be contacted. Other people who do have a vaccine provider and are 65 and older are being contacted directly by their healthcare providers. And basically most healthcare providers are doing that from oldest to youngest. So I'm not going to spend a lot of time on this, but this is just to demonstrate that the vaccine distribution from the federal government down to the local communities is getting more complicated as we move along. the federal government, through Operation Warp Speed, allocates the vaccine. We know that in January and February, that was given to long-term care facilities, and that was provided directly by Walgreens and CVS stores. Also, during that time, this and continues, Operation Warp Speed gives vaccine directly to the Iowa Department of Public Health, who then allocates it to the counties, and then the incident management team further allocates it to our approved vaccine providers. There's also a distribution through the federal retail pharmacy program. And initially, pharmacies, drugstores receiving vaccine through that allocation were determined by the Iowa Department of Public Health, and Hy-Vee and a network of CPSEN, which Mercy One Pharmacy here in Dubuque is a member of, received some limited doses. But as we move forward, the federal government will allocate doses directly to a variety of pharmacies that have signed up to be vaccine providers, and some of the ones in Dubuque County are listed there, and there's probably others. And then finally, eventually, we hope that our community health centers, specifically Crescent Community Health Center in Dubuque, will get vaccine allocated directly from the federal government as supplies allow. So with all that, where will I get my vaccine, or where will you get my vaccine? Well, it may depend. We have providers who are distributing vaccine through our community point of distribution, our pod, which is the former Yonkers Women's Store at Kennedy Mall, and that is a number of providers that are out there. Providers are also giving out vaccine in their own offices for their patients or people that we send to them. Hospitals through their various clinics, pharmacies, as I mentioned, public health clinics, which we haven't, currently the VNA would serve as our public health clinic administrator, and they are administering out at the pod. But right now we haven't developed any open public health clinics. And eventually people may get their vaccines through work sites. So as we talk about essential employees and going into how you think about whether you're going to get a vaccine or your employees, it's important to remember that in the vaccination phases and priorities, essential does not equal important. The vaccine priorities are laid out in the state of Iowa, very specific, and they define the type of essential worker that is eligible for the vaccine. So for instance, this is where we are right now. We are in phase 1B. Phase 1A was healthcare workers and long-term care residents, which is completed. So phase 1B and all through phase 1B, we have to continue to vaccinate age 65 and older. But within phase 1B, there's subgroups called tiers. And the first one included first responders, in other words, police officers, EMS providers. It included school pre-K through 12 staff, teachers, and then it also included early childhood staff and childcare providers. So this week we'll be wrapping up all of those folks. We still will have to continue to work on the age 65 and older because that estimate of almost 18,000 people is not complete. So then we will move into phase 1B, and we're going to start with that somewhat next week. So phase 1B is frontline, and this is how they define essential: food, ag, and manufacturing who live or work in non-social distance settings. And that's where you guys come in. It also includes individuals with disabilities who are dependent on an attendant care staff. That's a more refined group. So we are currently working with the Chamber and the Greater Dubuque Development Corporation and the Dyersville Area Chamber to help us get lists from the work sites in Dubuque, because we don't have an overall list of employers, a comprehensive one, and we certainly don't know as an incident management team which ones are essential based on this definition. So the Chamber and the Greater Dubuque are assisting with us. And if you have not received an email asking for some information from Greater Dubuque, then I advise you to reach out to them. So this tier 2 that we're now entering in, people must be in one of the sectors identified, and manufacturing is pretty broad. And they also have to be working in a setting that they cannot socially distance. So this may include production and factory type workers, and not all the workers within that employment would qualify. For instance, if they're administrative and they're working from home, or they have their own separate office. So we'll be working with each individual employer to sort through those groups. And as we gather names of individuals from various work sites, when vaccine becomes available in the quantities we need, we will give that information to one of our vaccine providers. And it could be Mercy One Pharmacy, it could be Grand River Medical Group, it could be VNA, or a number of our providers who will contact the people directly with an appointment to get their vaccine, and they will tell them where to go. So getting through tier 2 of the phase 1B is going to take some time, and tiers 3, 4, and 5 are much smaller groups than the essential manufacturing group as defined in that tier. After we get through phase 1B, which is most likely going to take several months, we will look ahead to phase 1C, which is a very broad group, and that includes people 16 to 64 who have underlying medical conditions which put them at risk of serious life-threatening complications from COVID-19. And it's important to remember that not every underlying medical condition puts you at risk for these complications, but we'll be sorting through those. And it also includes a broad sector of other essential workers, such as transportation and logistics, food service, housing construction, information technology, your IT folks, communication, energy, law, and media. So that's going to hit a lot of people. So that's where we are, and this is going to take some time. And sometimes we hear about new vaccine allocations, as you all do, on the news. And it's been said this week that the Biden administration has secured a lot of extra vaccine and will be able to ship it out to the states eventually. And so Iowa should be the recipient of some increased allocations. Right now, we're getting about 2,340 doses a week, and that does not include the booster doses. You have to get 2 of the vaccines. So if you think about all the people in these groups and these priority groups, I think we all have to be as patient as possible and keep being safe, wearing masks, and those kinds of things. So that's kind of an update of how the vaccine will come out, where you may potentially get it, and what groups will be served first. So there's our team and contact information. And by the way, I will give this slide presentation to Ryan and the Chamber folks to send out to everybody, so you'll have this if you have further questions. So I'll kick it back to you, Chamber, Ryan, and we'll look at any questions.
Thank you, Mary Rose. Yeah, I just noticed that my name says Ellen Sandberg-Shook, but I am in fact Ryan here. I'll invite the rest of the incident management team and Cheryl to kind of open your camera as well, just so everyone can see the panel here. As we said at the very beginning, if anyone here has any questions, go ahead and put that in the chat, and we will make sure to read those off and get those questions answered for you here today. While we're waiting to get some questions, I thought maybe we'll start off on what you just mentioned there, news about possible more vaccines. And then we also saw today that the FDA oversight panel that was looking at the Johnson & Johnson vaccine said that they're going to be recommending it for emergency approval as well, probably on Friday. So with that, I think very exciting news. How do you think that will affect the distribution? Do you think it's going to speed things up a lot? Do you think, we're looking at, just a little bit quicker? How do you think that's going to affect the distribution here in Dubuque County?
Well, I'll make a couple comments and then I'll throw it back to the team. But first of all, nobody really knows the formula for how this vaccine is allocated, either to the states or the local communities. There's a base population rate, but after that, it's we're really not sure. And from here on out, it's also based on the amount of vaccine you're able to administer within a week. So we have to get 80% of the vaccine we receive into people's arms within about a 5-day period. So the other thing is, it's great news that Johnson & Johnson is probably will be getting EAU or emergency use authorization from FDA soon, but that will take a couple weeks to start kicking that out too. And it will be a different method, one dose. And so our providers will have to learn about that vaccine and how to administer and what to watch out for. Does anybody else want to add anything?
Nope, you covered, Mary Rose, what I was thinking as well. This is Patrice. Thank you.
This is Stacy, and I would just add to what Mary Rose said. I think she covered it very, very well. I think when we look at the different vaccines and how they get distributed, we hope having a third vaccine in there will increase the numbers as we move along. Logistically, I think a lot depends on storage capability and things like that, differing in each county to determine what gets allocated in that way. So I think it'll be interesting to see how it goes, but we can only hope that a third vaccine will indeed increase our allocations.
That's excellent insight, and important to know, I think, for everyone how that'll affect us here. As we're waiting for questions, another thing, just as you lay out, the enormity of the task of vaccinating this many people. Once we get into the less specific tiers, and it's more kind of like, the general public can come get a vaccine, how do we expect the method of distribution to change? Do we think that there will be more community sites where anyone can go, whether or not they've gotten a call from their doctor? Or how do we expect that to play out in the coming months?
I think that'll eventually happen, yes, especially as the federal government starts allocating vaccine to the retail pharmacies. I mean, we have a number of Hardigs, we have multiple Walgreens, we have Walmart, we have Target, we have quite a few and even more vaccine providers who have signed up for that program. And so that will be great once that kicks in. And even if they do have to focus on certain priorities, it'll still be a big help. And in addition, those drugstores are assisting the incident management team to allocate doses we get from the state of Iowa before they're getting their other doses now. So that's a big help too. Some of our occupational health providers are the ones that, as they start doing work sites, they may go on site for the work place, depending on what the work the employer wants, or they may send them to the pod for their vaccines, or if it's a smaller group, they may send them to a pharmacy or another healthcare provider. But that's the kind of thing that the incident management team works on with the vaccine providers at least weekly, if not more often. We're meeting and deciding how to transfer vaccines and seeing who has some left and what groups we have identified waiting. So is there any spots I missed, team?
This is Patrice, and the only thing that I would add is that we're just very, very fortunate, as Mary Rose had said, with our pharmacist providers that we do have, and a lot of them have stores throughout the county. So that's nice that we're hoping that more, possibly down the road, more of those pharmacies will be able to administer out to the smaller towns in the county as well.
That's a good point. And the other one is Crescent Community Health Center. We are giving them allocations from the county, but if they have another source directly from the feds, that'll help out not only their patient population, but we'll ask them to work on other populations such as uninsured or perhaps some of our more vulnerable populations and others as we need to finish up.
Perfect. So I'm going to hand it to Justine here, who has some questions from the audience. Justine, if you want to go ahead.
First question, what documentation do you need when your category is available to receive the vaccine?
Well, right now, through the essential workers, we're working with the work sites to help us identify the people who qualify based on how their work setting is. So once the employer gives the incident management team those names and contact information, and we contact them directly for an appointment, they'll simply have to verify who they are when they go to the vaccine site. And then for the 65 and older group, I don't know, Stacy, are you verifying that at the pod? But the providers all know dates of birth on their patients, so they don't have to provide that at this time.
You're correct, Mary Rose, and I think some of the providers that have been seeing the 65 and older may be requesting insurance and personal verification. I know for VNA specifically, all that we request is identification, just to ensure that the person that we are vaccinating is indeed the one we scheduled. So it's pretty similar across the board with some minor differences.
Yeah, and Stacy, you brought up a really good point I forgot to mention is the vaccines. There is no charge to receive the vaccines. The providers don't get charged for it. The recipient doesn't. The administrator of the vaccine may bill your insurance for an administration fee. And if you don't have insurance, that's not an issue. They can vaccinate you anyway, and there is an avenue for them to bill for uninsured individuals through the federal government. So it is a no-cost issue, and you can't be refused a vaccine for inability to pay or lack of insurance.
Excellent. Next question we have is phase 1B says all Iowans age 65 and over and other high-risk populations. This person has a kidney transplant. What is considered high risk?
The high risk are further defined in those tiers in 1B. So if that person is not 65 and older, they wouldn't fall in this phase 1B. They would fall into the 1C of the group that has underlying medical conditions that may put them at risk.
Okay. Next question. Will 1B tiers 1 through 5 all have to fill out before they set 1C begins, or will that happen simultaneously?
Our goal is to complete 1B, all 5 tiers, and that's pretty much the way the Iowa Department of Public Health wants us to do it. There may be some slight crossover as we reach tier 5 and be getting more vaccinations that will start in with the next phase of 1C, but it'll be pretty minimal crossover. That's our goal right now. Now, everything I'm saying as a disclaimer on what the feds decide to do and change the rules and the state, it changes a lot. So that's my disclaimer on all of this.
This is more of a statement than anything, but it says, thank you for the great work of the county and the city have done. You've been a lifeline to us in industry. And they have to say that 1B tier 2 is very difficult to interpret. The state would benefit from cleaner definitions.
Yeah, I think we all agree with that one.
Yeah.
Another question I have is, will employers have the option to have an on-site vaccination clinic at the workplace versus employees being contacted individually and going in on their own?
Mary Rose, I could,
go ahead, Steve.
I was going to say I could probably potentially answer this. I think it depends on the employer. If they're connected with an occupational health department, there is potential to possibly do it on site, but there are a lot of logistics to think of. Nursing, safety, storage capability of the vaccine. So I don't think we could give a definitive, yes, everyone could have it on site, but there are potentials to do that. And then also potential to bring them out to the pod site as well.
The other thing we can look at is businesses and work sites that are actually located close to each other could have one site at those at one particular business where multiple could go to. The registration of getting regardless of who sends the information for the appointment or schedule them, they need some information ahead of time to make that actual vaccine administration go a little quicker. Because if people are filling out their name and address and date of birth and all those things ahead of time or at the site, it greatly slows down the administration. So we want to have as much of that collected ahead of time, so when the person comes in, we have all their information. And also we have to enter each vaccine into the state immunization registry within 24 hours of administering it. So any information we have up front can speed up that process. Do you have anything else to add to that, Stacy?
No, I think you covered it really well. I think there's always going to be that component of contacting people individually to gather information ahead of time. But we are certainly open to working with different employers on potential solutions of the best way we could get the vaccine out within a short amount of time. Because, you know, the biggest thing there is we also only have very precious few days to get these vaccines out each week, which also inhibits our ability to really have a lot of open scheduling too. So I think just all in all, there's just a lot of possibilities, I would say would be the best way to say it in terms of on-site versus a pod versus going to a medical provider for that vaccine.
One thing, I'll just jump in here real quick too, kind of back to this person's question, kind of thinking about, is there a middle ground here? And we're kind of helping a little bit on this by doing the outreach to local businesses with GDDC, but is to the questioner's point, is there opportunity for employers to help with the coordination beyond just identifying who qualifies? So imagine the incident management team reaching out to an employer that has a few hundred employees and says, let's get your employees in over the next week. Is there going to be that type of outreach, or to their point, is it going to be calling individual employees and having them come?
Well, I'll start out with this and I'll let Stacy finish. We start planning for individual groups of people a couple weeks out, or we try to anyway, before they're going to get the vaccine. So there is time to work with employers in the planning. And I'll let Stacy jump in on other things that the employers can do, one of which for sure is to promote the vaccination, the safety, and the benefits of getting the vaccine to people who are vaccine hesitant.
I think Mary Rose said that very well. I think we definitely do try and have enough time ahead of time knowing where we're heading in to work with employers. And I think the closer they can work with us, the better, whether it's, adjusting their work hours to allow them to meet the needs within that short week time frame that we have to give the vaccines. It's not always feasible to say we could do it all on a Saturday or all in the evenings. So having that coordination from the work site is extremely helpful. It's also helpful, I think, for the employer as well. If they're working closely with us, they're going to know when we're offering these vaccines and at what times, and then can take a look at their own workforce and determine, do I want to send them all at once? Do I want to send half this week and half the next week? And so there's definitely, we're very, very open, and we very much encourage coordination from the work site.
And one of the conversations we'll have with employers is you may want to break up the days that your employees get vaccinated, because there are some side effects. Person may have chills and a fever and be really tired and not be up to coming to work later that day or the next day. Those usually go away after 12, 24 hours or so. But so you don't want to have all your critical people that have to be there getting vaccinated on the same day. And those are the kinds of things the employer can help the team with in planning how to vaccinate, so you're not strapped without staff, for instance, for a day or two.
Great, great. And I'm going to bring Cheryl in here real quick, and then we'll hop back into the audience questions. But Cheryl, just being at a medical provider already, you've kind of gone through a little bit of this process and planning and figuring out how to get everyone on staff vaccinated. Can you talk a little bit just about the processes that you had and how you worked with your employees to get that done?
Sure. And before I do that, I wanted to make a couple quick comments regarding what we were just talking about. Medical Associates was pretty involved with helping vaccinate the teachers, and I can tell you that what works best is if we get a standard list of information on everybody that we're needing to contact. And so in the cases where we had first name, last name, cell phone number that's accurate, an email address that's accurate, last four of a social, and a birth date, we could easily do some work with spreadsheets and get people to match up to patient records that we had here so that we could not only reach the person, but then document the vaccine in their chart and everything too. So the list that came in from the different schools for the teachers were in different formats, and that caused some lag in reaching people. So just if any of you guys are starting to think ahead about preparing a list of your essential workers, if you could keep in mind those sort of fields, because if you have a spreadsheet with all that stuff on it, it's very easy to delete a column we don't need, but very helpful to have in terms of making that process quicker. And then in terms of working with the employees, if there's a contact person who could maybe shoot an email out to everybody and say, hey, it's our turn, be looking out for an email from or a phone call from these people so it doesn't wind up in spam filters or as an unanswered phone call. That kind of thing makes things go a lot faster, because thus far we have been doing we will contact you and set up an appointment process, because there's not vaccine for the general public, and that keeps us from getting swamped with people that aren't qualified. So kind of keeping that in mind. The other thing is, I did talk to Tina Wagner this morning at Tri-State Occupational Health, and she's very eager to potentially run some services similar to what they would do for flu clinics in a normal year. It's just a matter of having the vaccine allocated to them to be able to do that. So I know they're one of the big health employers in town and or providers in town, and they're eager to do that. So whenever we get to that point, I think there's options for how to set that stuff up. It's more of a vaccine supply issue than anything at this point. But to your question, yeah, so we being healthcare workers, we were phase 1A. We've gotten over 80% of our team vaccinated here at Medical Associates, and I think that's pretty common across the hospitals and the other healthcare providers in town. We found the most helpful thing to do was to get a bunch of information out there ahead of time. So our Chief Medical Officer, Dr. Hendrik Schultz, has been putting out a lot of different informational videos about vaccines and how they work and how these mRNA vaccines work and how they're safe. And I think the more people become comfortable with the science, the more they're comfortable with the idea of getting the vaccine. And the more people in the community who have received the vaccines and are walking around fine and haven't mutated into zombies and whatnot, the more people feel comfortable when it's their turn of getting the vaccine. So we did it mostly through education. Most healthcare workers are pretty aware. A lot of us have been taking care of COVID patients and see the effects. And so people know the importance of vaccination for beating this thing back. And so our teams were pretty ready to get it. What we found was that out of the small group of people who didn't get the vaccine, or at least didn't get it yet, of our team members, it seems like they tend to be in groups that would not necessarily have been motivated to get the vaccine, even if we had decided to go any sort of incentive route. Their reasons for not getting the vaccine, I personally don't think would be motivated by incentives. They tend to be things like, I'm pregnant and even though the ACOG recommends I get the vaccine, I'm personally not doing it, or I'm nursing and I'm not doing it, or I just had COVID and I want to have a few months before I consider the vaccine. Even though those things aren't necessarily recommendations that they should have, they're reasons for people to be personally hesitant. And I don't think if I gave somebody $200 or a grocery store voucher or whatever, that anybody would be changing their decision to get a vaccine based on that. I think it's a lot more about how comfortable are they with the science and the information. And so I would advise employers to start getting out ahead with that. I know there's a lot of great public information out there. We've got a bunch of videos out there from medical associates, and I'm sure other people do as well. I would be thinking about how to get your employees that kind of information to get them prepared for it. Is what I would do.
And Cheryl, you brought up a point kind of crossing over with our presentation is as your employment place or your group gets eligible for vaccine and you want the vaccine, this is like an A1. So when you get called with an appointment or you can schedule one, you know, if you have a hair appointment or a dentist appointment, move it. Because as you can begin to understand, the logistics and planning and scheduling all this is nothing short of a nightmare. And we really can't accommodate individual requests to change or move those kinds of things. Now, people that miss appointments for extenuating circumstances or whatever, we collect those names and we fit it in at another time. But this is like an A1. So employees need to know how important it is to make adjustments in their schedule, and likewise, work sites, depending on when you're allowing your employees to get vaccinated, have to allow them to either leave work or whatever. And then that gets over into Cheryl's world a little bit. But you have to, you know, allow your employees the feasibility to actually get to wherever they need to go to get the vaccine.
Exactly, and I think one of the things that people don't realize is that the Pfizer, for example, has 5 or 6 doses in a vial, and the Moderna has 10 or 11. We don't always know exactly how many are coming out of each vial, so that leaves a little bit of wiggle room, and we don't ever want to waste a dose. So we're really going on exact accounting of how many vials we need, and we're pulling them out of the freezer, assuming we're giving a certain amount of shots in a day, and you can't just guess about that stuff and waste a bunch of vaccine when it's in such short supply. So we really try to figure out exactly who's coming in for appointments and when, and make sure that that 6-hour window or wherever that it can be at room temp, that every shot is used. And so it's not like other vaccines where you can just bring one shot to somebody and give it to them and that kind of thing. It has to really be the math around the vials and how long it's good for and stuff. And it's a lot more complicated, like Mary Rose said, than people think.
One more question before sorry, Justine. But kind of on the topic you mentioned at the very beginning, Cheryl, with like forms that people could have ready ahead of time, things like that. You know, as we're working with employers to try and help them get vaccinated, we would love, I don't know if it's the IMT or maybe medical associates, but I know the chamber would be happy to help kind of distribute that form, or at least and help facilitate people having that information prepared ahead of time. So just an offer of us to work together on that.
Yeah, no, I appreciate that. And when we were working with the school systems, for example, there are a couple of forms. One's a vaccine information form that's helpful for people to read ahead, and we were trying to get that out to, you know, like the school secretary or whoever the focal point was. But the other thing is people need to answer a checklist of questions before they can get the vaccine. And it's good if people can read that ahead of time and get it ready, because it makes things go faster. But also, if you're going to flag out on one of those things that's going to make you unable to be vaccinated that day, you want to know that before you take an appointment slot and show up there. So I appreciate that.
Patrice, do you want to talk a little bit more about the details of how the process is with working with GDC and the chamber and the email that went out?
Sure. And again, we're very, very thankful for everyone. I mean, for our partners, for our networking, everyone that has assisted the incident management team. What has gone out are basically sheets, data sheets. And as Cheryl had mentioned, it's just collecting, you know, those names, the cell phone numbers, the email addresses, just the basic information that if we needed to reach out to call anyone to come in for their vaccines, that we're not wasting time because we're not getting connected to that person. So once those sheets are completed currently, they are being sent to our office. Samantha Clough is the assistant health director that is pretty much the keeper of all of our databases. She was basically from day one with our vaccines, and she'll continue until we have the last vaccine in the last resident of Dubuque County. But then she is able to, once we have a vaccine provider established for a certain company, then she is able to distribute those data sheets to that vaccine provider. So we are trying to help in any way that we can for that vaccine provider to be able to have all of that information up front and that it's accurate information. So there, as Mary Rose said, you know, there's a lot that goes into all of the planning and the processing, and what the incident management team is trying to do is just to make it a lot easier for our vaccine providers to be able to administer those vaccines, because we know that their time is quite valuable. And as Cheryl had said, you know, we've got X amount of time once we do thaw out or even open up a vial to get that into a person's arms. So it's complicated, but it has been working.
So basically the flow is employers, and hopefully all of you received an email from GDDC with a Google survey link. And then what it asks for some real basic information about your work site, like do you have any workers that fall into this tier, et cetera. And then Sam at the health department, she looks at all of those and then forwards them the more detailed spreadsheet to fill out. So then we start collecting the more detailed information. So it's a little bit of a two-step process.
Question we have is, do we currently know how many individuals in the 65 and older category have received their first dose and how many have been fully vaccinated?
I can probably figure that out. I don't have it in my head right now. The incident management team has access to more detailed databases with the Iowa Department of Public Health where we can run reports. So I can look at that and maybe get back to you, or we can put it in one of our public health daily updates. By the way, we do a daily update through our public information office, and that's Randy Gale with the City of Dubuque heads that up, and you can subscribe to that and get it via text or email. It's a great way to kind of keep up to date on what the current cases are, how many people are vaccinated, and any new news coming out. So we can get that link to the chamber. It's based on a Notify Me system we have with the city. Some of you may already be getting that.
Mary Rose, do you want to mention your Facebook presentations as well?
I do a video Facebook update about twice a week, Mondays and Thursdays, except if I have a council meeting on Monday night, which is the first and third Mondays of the month. I always give a pretty comprehensive update to the city council, which you're welcome to listen to, that has a lot more detailed information. On the Facebook videos, I try to do anything new or more succinct in information the general public needs to know.
This is a follow-up question to the documentation. The question really was asking, what documentation do you need to prove you're employed in this category? So I guess if it's for manufacturers, what do you have to do to prove that you work in manufacturing?
We'll be working with the HR people and the head administration of the employer to determine that, because they know where their workers work and how they're spaced and those kinds of things. So once we have those names from the employer, that's how you will qualify. And we'll work with them to help them identify those people, you know, based on what they do or how they're spread out.
So basically, as an employee, you won't really need to provide documentation. Your employer will already have done that.
Not in this next phase of 1B anyway, for sure.
Yeah, so right now it's like a pull system, and so we'll have a list of names, and that's why that phone number and email and last four social and date of birth is so helpful, because we can pull the people and call them and tell them it's your turn and you can come get an appointment. And so once we've called them, then we know who they are, and then they just need their own self to show up. There's no real like, I'm a official category person, I'm gonna just show up somewhere and get a shot. Like, that's not a possibility at this point in time.
A question about locations getting vaccines. What's the time frame that they're going to know ahead of time that they're going to receive vaccines? Will they know 1 or 2 days before receiving it, and will they just open the appointment times right away?
Yes, they will know a few days ahead of time. They might not know much more than that. So we don't really know the notification process to them yet. We work closely with them so that they would notify us, and then we can put it in our daily updates. But just basically, it's best to kind of watch those various pharmacies' websites and see if they have vaccine available or not for now. But we really don't know the lead time, because beyond next week, we don't know how much vaccine we're getting or to who, unfortunately.
Okay.
And also another good resource with the pharmacies would be if people could go to the COVID-19 in Iowa. They actually do list like the different places like Walgreens that do have the vaccine. They will actually say which Walgreens in which county. Not all of the counties do participate in this, but it's just another good resource if people are looking for additional information for the pharmacy vaccines.
So I can forward those key website information to our host today that can get those out.
I just thought of another tip for employers. If you think you're coming up in one of these categories relatively soon, it's helpful to ask in advance your employees who's actually wanting to get the shot. So we found that asking our employees ahead of time, do you want to get the shot at your earliest chance? Are you wanting to wait till later, or do you know for sure you don't want the shot? I found a lot of people in the wait till later category are actually people that don't want the shot, but they just don't want to tell you that. But either way, you want to get those people segregated from the people who definitely want the shot, because what ends up happening is your list comes over to us or whomever, and we think we have 1,000 people, and then we call 1,000 people, and we find out we actually only have 500 people because your people all don't really want it. And that's an awful lot of wasted time on behalf of a lot of people. If we could just find out that person doesn't want it, don't call them. So that's a tip that would be awesome.
Is there information online about phase 1D? I know the CDC is pushing the 1B information right now. Is there 1D information out there?
I don't think so.
Okay.
That will be phase 2.
Okay. Okay, good to know. Someone's asking, who is sending out, or who do we contact about the second form for employers to complete to supply you with the names and contact info of the employees? So I guess this might be people who didn't receive the survey link.
Yeah, Sam, do you want to comment on how you'd like people to handle that?
I don't know if Sam is on, Mary Rose.
Oh, okay.
I mean, she might have joined, but I know she had a conflict.
Okay.
I would just, pardon me?
I mean, you can go ahead and tell how you think we want to do that.
Yeah, I would probably say if you did not receive anything as far as that survey, that you could either contact, one of the chambers to see if indeed you were missed, or, if they still are in the process of notifying you. Otherwise, I would probably just say to contact Samantha Cloft at the health department, the Dubuque County Health Department. If you'll just send her an email, then she would be able to follow up with you to give you whatever information you were lacking.
Justine, can you clarify? That person was asking, like, they received the initial email, but they haven't received like the detailed spreadsheet, right?
Okay.
They don't have that listed. They're just asking who they contact. It doesn't say if they've received anything prior.
Okay, and the detailed information will be coming, but right now we're just gathering the first survey itself. But Samantha will be working on that. So if you have not gotten the more detailed data sheets, please know that it will be coming. But we did get quite a few responses, so it might take us a little bit of time to get back. So.
Okay, and they clarified they did receive the initial survey. They just hadn't received the
Okay.
detailed information requests. Okay, so that's perfect. Thank you.
Yeah, you're
Uh,
welcome.
Another question, will the employers also know a couple of days notice with the vaccine is available for their employees?
Absolutely. Hopefully, if we're going in the same kind of schedule we are now, you'll get a hint that it's going to be available 2 weeks ahead of time, and you'll get a really good idea a week ahead of time, because we order the vaccines for the following week on, we planned for that on like Monday and Tuesday of the previous week. Did I get that right, Stacy?
You did. There are, we usually know ahead of time at least how many doses are coming in, and as a group, we sit down and start making those plans. So I would say at minimum a week ahead of time, they would be aware. The only outliers there would be is if we had a vaccine that we know and we already have the information from an employer, we might try and get a few of their employees in, but that would be a very rare occurrence. For most time they would have at least a week notice, hopefully two.
All right, we have time for one more question. Will pharmacies also be getting the list from the county to know who is qualified for a vaccine when they start receiving them?
Yes. We're already doing that. We're starting to do that for next week. Harding's is going to be doing a couple of groups of people for us. So we give them the list and then they make the appointments.
That looks like the questions I have. Ryan, I turn it back over to you.
Excellent. Well, thank you, Justine. Thank you, everyone on the incident management team and Cheryl with Medical Associates. We really, really appreciate you being here today. I know our business owners also really appreciate this information. As you noted, there's a lot of uncertainty here, and so providing more certainty is always a good thing. And so really appreciate your time, and I know you're very, very busy. As we end here, I want to again just thank our ultimate presenting sponsors for today's event: Medical Associates Clinic and Health Plans, Midwest One Bank, Q Casino, and TH Media. They make this possible. They make all of our events possible, and so we really appreciate their support here. With that, we're going to go ahead and close the webinar. If anyone needs anything in the future, don't hesitate to ask. We'll make sure to follow up with this recording on social media and everywhere else. So thank you, everybody. Have a great rest of the week.
Thank you.
Thanks.
Thank you.